mean you don't hold the top of it or something, right?
So what happens is when you take it out, when you take off the top, this part pops.
Mm-hmm.
That's the part you press, because when you take this bottom off, the needle will come out this side, the top pops, so you can stick it in. So you jab the needle in and then you press the medicine in.
Okay.
Okay? Give it about 5 seconds, take it out and rub it so it lets the thing disperse. You'll see something immediately. You'll see the person calming down. If you don't, call 911. They might tell you, hey, you need to either give the person another one because it comes in packs of 2, or they'll be on their way. If the person continues to vomit or something, they'll be on their way. But it's also self-explanatory. But when a person is having a reaction, always administer this first before you call 911, because it goes from 0 to 10 really quickly. So this shows what to do. Shock. It's a disruption of blood. It's when people they might see too much blood, or they might have been in an accident. They may not really be hurt, but it may be scary enough to disrupt their blood from flowing. Okay, they get enlarged pupils. They might throw up. They'll be thirsty. They'll be pale. Maybe dizzy or confused. For a shock, you just lay the person down. Just have them relax. If they're bleeding, you want to elevate their body parts, right? Don't give them any food or drink, because if they throw up, that'll make it worse. If a person is having a seizure, there's complex seizures and simple seizures. For the complex seizures, there's really nothing you can do about it. If you can, if it's not dangerous for you, roll the person on their side. They used to say, try to press the tongue down. Don't put your hands anywhere near their mouth. They'll bite your fingers off. Clear the space. They'll go through their seizure. They'll wake up and then they'll feel a little bit tired. You just have to let them go through the seizure.
That's what they say, take off their shoes and let their smell it. You know that one?
No, I never heard that.
Yeah.
Me either.
Yep. Take off their shoes and let their smell.
How you get the shoes off if they're shaking?
Yeah,
That might be.
No, that's why. They said that. That's why. That's all. No, old
Yeah.
people, they have different type of.
They used to say try to put a spoon in their mouth so they don't swallow their tongue.
Yeah.
But they'll bite that spoon real hard. You know, they're out of control. So you want to make sure not to go anywhere near their mouth. And just let them go through the seizure. That's just a video of somebody having a seizure. If a person is having a stroke, they have this acronym they want people to remember, and it's called FAST. So if a person is having a stroke, you'll see either drooping of their face, they can't speak, they're dizzy, they might lose their vision, or a sudden or severe headache, and difficulty swallowing. So what they want you to do is what is called FAST. Check to see if the person's face is drooping. That's one signal. Check to see if their arm is weak. So if you ask the person to raise both their arms, one will stay down, the other will go up. Okay? Speech. If the person can't repeat a simple sentence, ask them what their name is. Ask them what color the sky is. If they can't repeat that, they're possibly having a stroke. And then the time. Make sure you note what time you see this person having these symptoms, because now they have treatment where they can reverse a stroke, which is something they never had before. But they can reverse it if it hasn't been too long a time. So make sure you know, okay, at 3:30 this person started acting strange. Any questions? Fast. All right, concussion. I think this is one of the last ones. If somebody, it's really when your brain hits the side of your skull. So if a person is dizzy, if they have a headache that doesn't go away, trouble focusing, throwing up, they're not balanced or coordinated, having difficulty making decisions, or they say things that don't make sense. You all know you have these little ones, they'll go somewhere, whack their head and keep on going. You just want to make sure that they sit for a minute, their eyes aren't shifting all over the place, they can talk, and they don't vomit. Those are the main signs. If you see that, then they might have a concussion. And there's really nothing you can do about that. They need to go to the hospital, and then it's just rest for their brain. We went over choking, and that's it. First aid is done. So I got a quick quiz for y'all. Okay, how many compressions to rescue breath do you give?
30 to 5.
30 to 2.
Oh,
No, 32 times.
30,
2.
30 to
Oh,
2.
2. Oh,
30.
32. To 2.
You said you had
Yep,
to
yep.
30 compression is 2.
Oh, because
Yeah.
we did 5 at Double Place.
Yep.
That's why.
yeah.
It's 30 to 2.
Yeah, yeah, yeah.
30 to 2
Yes.
For a baby, for an infant,
is how many?
30 to 5, right? 30 to 2.
4.
15 to 2.
Uh-oh, do we have
For
to go?